Hi, what are marionette lines and how can you treat them? The marionette lines are named after those puppets where the mouth here moves up and down, and they describe little folds of skin here. They're normal, they happen over time because the skin is losing its collagen and elasticity, and it gets more lax and follows down with gravity, and then the underlying bone is shrinking a little bit. And over time, the nasolabial fold gets heavier and the marionette line gets more obvious. People will come into me and say they look a bit down in the mouth or sad, and as the lips are thinning, it's almost like a child drawing an upside down smile, and people don't like the appearance of it. I'll also see older people where the fold is very deep and it forms a channel and saliva can continually leak out and make the skin sore. And in those patients, I'll use a technique to help improve the corners and lift and support the area with hyaluronic acid dermal filler and almost sandbag up the corner of the mouth so they're not leaking saliva. And for some people, that's really effective and improves their confidence. If somebody doesn't like how it looks, we're thinking, okay, don't just jump in here with filler and fill it. Look at lifting up the soft tissues. And we can do that with things like biostimulators like harmonica, things like Sculptura, things like Elance, or we can use the more robust or stronger hyaluronic acid products. And we inject them in certain patterns to help get some lift. They're not going to give you a surgical result, but for something like this, they can give a good improvement. So the first is to lift, and then you can come back and tidy it up and improve it. What you don't want to do is have a big blob or a big sausage of product here, because then it looks like somebody's got a gobstopper in their mouth. And also if you do too much, you can leave them with a blob of filler that you end up chewing on, and it becomes almost like a worry bead. We want to go very carefully. So yes, I'll use things like dermal filler, but I'm looking at the whole chin, essentially the whole face. I'm looking at the support around the mouth, and I'm not diving straight in with the product there. The other thing is that there's often a muscular component to this. So one of the muscles here called DAO, depressor anguli oris, pulls the mouth down over time, as do the platysma muscles here. They pull down and we lose definition. So you're looking at the whole area as a functional unit, and you're saying, okay, lift it up, maybe consider some botulinum toxin on prescription with a doctor or dentist only in Ireland, and have some toxin to stop this pull down. And then this little muscle area here is called the modiolus, and lots of muscles link in here. And if I make this team weaker in a tug of war, the lifting muscles or elevators will lift up, and you actually stop the pull down, but you also get a nice subtle little lift in the mid face. And if I put some toxin along the border of the mandibular bone here, I'll help stop that platysma pulling down, and I'll improve that whole area as well. You can do things like microneedling if there's little bits of scarring or tethering, or if the skin is puckered from acne scarring. And we use a technique called subcision, where with a little blunt needle called a cannula, we'll help sort of improve those ligaments and the little scar tissue areas to release them a little bit and stop them folding in as much. So I think if they don't look nice and they're bothering you, they can be treated, but especially worth treating in older people where there is a functional problem. And how you'll know that is there's saliva leaking, or I've sometimes seen elderly relatives and they're dabbing the whole time and the corners of the mouth get sore from that repetitive saliva onto wet skin. So I think they're normal. They don't always have to be treated, but if somebody doesn't like the appearance of them or they have a functional problem that's affecting their confidence, by all means, they can be treated. And it's looking at the whole area as a whole, lifting first, yes, coming in and supporting, and then recognizing what part the muscles are playing, and if necessary, reducing the downward pull at the corner of the mouth. I hope that's helpful, and do feel free to get in touch if you have any questions. Take care. Bye.